Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma, reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma, reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma, reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma, reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma, reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma. Reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma. Reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma. Reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us. Bioderma. Reveal the intelligence of the skin. Dryness, redness, scars. Just a few of the daily battles or skin fights. At Bioderma, we look for the answer within the skin itself. Your skin is unique, surprising, brilliant. It knows how to defend itself. Naus's approach, ecobiology, is born from this very need to understand, to respect, and to love the skin. Inspired by life, driven by science. Bioderma applies ecobiological principles to all its formulas developed alongside dermatologists. Its products act with the skin's natural mechanisms for a healthier skin. Skin is the mirror of life. It reveals us.
Good evening. It's our pleasure welcoming you all here today. This edition of IDERMATOLOGY by NAUS. My name is Shirihan Sharara, Medical Marketing Manager, GCC at Bioderma. We put NAUS ecobiology at the heart of dermatology. We consider the skin a living, smart organism that we support with care and respect to its natural biology. Today, this philosophy brings all us in a very special way. To share with you that today our eye dermatology edition is reaching the entire Middle East, Europe, and the wide world online and on site. This is the spirit of eye dermatology, uniting science and the practice for the best for the patient. Today, we have the pleasure to host two extraordinary KOLs, key opinion leaders. Professor Brigitte Dréno, who will be joining us virtually from France, and Dr. Anwar Hammadi, who we are going to welcome him here today on Professor Brigitte Dréno, Professor of Dermatology at Nantes of the National French Academy of Medicine and Chevalier of the Legion of Honor. In 2024, she was honored with the prestigious Scientific Award and received major research grants, including France, Singapore initiatives, and the Foundation de Gaulle Cathay. For 30 years of research in dermato-oncology, her work in clinical trials, innovative therapies, and scientific publication continues to shape the field of oncology. Today, Professor Dréno will share with us the role of dermocosmetics in acne treatments. Dr. Anwar Al Hammadi, consultant dermatologist at Derma Med Clinic in Dubai, clinical associate professor of dermatology at University, previously served as head of dermatology at Rashid Hospital and trained internationally, including a fellowship in dermatology at Mount Sinai Medical Center in New York. He's board certified in both the United States and Canada, and is a fellow of the Royal College of Physicians of Canada and of Dermatology. Dr. Al Hammadi chaired in this international conferences and has been recognized for multiple awards, including Sheikh Mohammed bin Rashid Al Maktoum Award for the most influential Arab on social media in health. And today, Dr. Al Hammadi will represent for us from patient to protocol. But before me share with you briefly something about who we are as a company. We are NOWS. We are the creators of 3 dermatocosmetic brands, Bioderma, Institute Estiderm, and Etapure. All of them built by the ecobiology. Ecobiology is our philosophy where we see the skin as a smart organ. Every and each ingredient we select is taken carefully to respect the skin's natural. Our vision goes beyond the skincare. Our founder, John Noel Turer, who is our founder and who shaped our philosophy, he is to a foundation, making NOWS as an altruistic organization alpha with no private shareholders. Every profit is dedicated to advancing health, supporting human potential, and contributing to greater social good. It's a model of responsibility that we hope. Thank you. Here, announce Prof. Brigitte Dréno.
Oh, do you hear me? Yeah. So, good evening, everyone. It's a real great pleasure for me to be here. And I am going to discuss with you about of dermocosmetics in acne. So, if I can just, yes, the role of dermocosmetic in acne. Here, when you use topical drugs in acne, you are of the main function of hair. So, topical and systemic treatment are going to destroy skin barrier going to alter the anti-radicular function of the skin, and finally, a very, very important function, which is the immune functions of the skin. So, alteration of skin barrier is a big problem because now we know that it is going to modification of the microbiome, what we name a dysbiosis. In normal skin, the microbiome controls activation of innate by any antigen and protect the skin barrier. If you have a staphylococcus, it will be destroyed so by the commensal bacteria. When you have an alteration of skin barrier, by example, cathelicidin and abnormal cathelicidin L37 in rosacea, then it means that you will have a modification, an alteration of commensal bacteria, and then so the penetration of pathogen bacteria. In acne, in a similar manner, the increased production of sebum, the modification of the quality of the sebum induce an alteration in the microbiome, and then so the development of pathogen, and finally also an activation of innate immunity. So any alteration of skin barrier induces dysbiosis of the skin, activation of immunity, and of antigens as pathogen. So in any case, we need, specifically in acne, as I am going to show to you, so you need to protect and repair skin barrier. For that, you need to protect so the skin barrier and in addition the microbiome, and then you will prevent cutaneous inflammation. So the first important player, cleanser. The cleanser is able to prevent the disruption of skin barrier and to keep the integrity of microbiome. For that, which is very important, is the pH of the cleanser. You need to have an acidic pH. Here in this study, it was mild acne on skin. 4 weeks clinical trial with 27 acne women, and you can see that only with the cleanser you have a decrease acne lesions. So as you can see here on forehead and cheek. So here they use in this trial Findet with a pH around 5, that is the pH of the skin, and an ordinary soap with a basic pH 8. And as you can see, concerning the retentional lesion, you have a significant increase of this lesion under soaps, not with the Findet with a pH 5. And concerning inflammatory lesion, only the Findet was able to decrease the inflammatory lesion. So the question, what is the scientific background explaining that? In fact, when you have in skin pH and an pH, you are directly modulate kallikrein 5, and then you are going to lose of the skin barrier and specifically an increase of filaggrin. So that's implicated in the development of comedon. And second thing, you are going to induce interleukin 1 or interleukin 1, so is able to induce the development of microcomedon. And as you can see here in acne, you have a significant increase of the production by the monocyte of interleukin 1. on the contrary in normal skin. And it is exactly here the same thing at the level of the sebaceous gland. So Cutibacterium acnes induce the secretion of interleukin-1 beta. So it's why is it very important to avoid a basic pH cleanser. Another important point is that the cleanser is going to remove useful intercellular lipids, specifically ceramides. It will decrease the water binding capacity of denatured keratin and increase finally dryness induced by acne drugs. So drugs to decrease their adverse event and finally to maintain the integrity of cutaneous barrier. Another thing which is important often, so our patients intensively, then they break the skin barriers and lead to a loss of antimicrobial peptide. And antimicrobial peptide are produced by our common cell to protect our epidermal barrier and to decrease the activation of innate immunity. So it's very important to avoid any detergent which can aggravate loss of antimicrobial peptide, specifically in oily area. And that is the case for acne, and then is going to increase the inflammations. Just here you have an example. In a similar manner, so moisturizing cream are very important in acne. They can prevent the disruption of skin barrier and keep integrity of the microbiome. So when you have an alteration of stratum corneum, you know that you have the development of microcomedon and then comedon. In fact, which is very important, is to avoid an alteration of filaggrin and natural moisturizing factor as they maintain the skin hydration. Either you will have an increase of water loss. So, alteration of lipid lemmas is also, as by example, ceramide, increase also permeability. Using moisturizing cream in addition of topical drug is going to decrease so the risk of water loss and at the same level to decrease the cutaneous cleanser moisturizing cream. And in a general manner, is it always better topical drug in the evening, specifically if it's retinoid, because under the action of UVB and UVA, they disappear in less than 1 minute. So you use and in the morning, so moisturizing cream to repair the skin barrier and to decrease the risk of adverse events. So just to illustrate, another point concerning the cosmetic. You know very well the use of benzoyl peroxide. So vitamin E is very important antioxidant. And in this study, what they demonstrate, when you use benzoyl peroxide, so you have 11 subjects. You first use topical alpha tocotrienol for 7 days on the back, and on another area, you use just at the day 8 and for 1 week. So in the vehicle part, so you use benzoyl peroxide alone. The combination, benzoyl peroxide and tocotrienol, the vitamin E. A single dose of benzoyl peroxide is able to deplete the vitamin E around 93%. That means antioxidant power of the skin. So when you have only seven applications of, You increase the lipid peroxidation, linked with the decrease of the antioxidant, and you increase the transepidermal water loss. And if you combine with vitamin E, you significantly decrease the lipid peroxidation, but transepidermal water loss was not modified. Days is too short. So, to think that concerning moisturizing cream, skin barrier irritation, we know alter epidermal innervation and increase the nerve density, explaining pruritus, explaining burning. So it suggests that you have an hyperinnervation, so in part responsible for this intense itch sensation. And the increase of intraepidermal nervous fiber and the production of an NGF factor decreased by the use of emollient. But be careful, so the level of decrease, the level of efficacy of moisturizing cream, as you can see here, is not always the same. So that is very important to help the patient to choose the good one. And here, you have to think concerning the skin and the microbiome. We have at the surface of the skin many commensal bacteria protect the skin barrier and to avoid the immunity. So you have a permanent interaction bacteria and the skin barrier. It's an ecosystem. And this ecosystem is very well explained because the commensal bacteria produce antimicrobial peptide, as you can see here, to protect the epidermis and to avoid the development, the activation of innate immunity. At the same level, the keratinocytes are able to secrete factor to maintain the bacterial diversity, all the commensal bacteria, and the harmony between these bacteria. And that interaction that we have to maintain, and for that, cleanser, moisturizing cream are very important. And now, which is also important, as you can see here, we are able not only to have a metagenomic approach, cryptomic approach, but we speak about metabolic and proteomic approach of the microbiome. What does it mean? Not only the name quantification of commensal bacteria, but what they produce. And in acne, by example, so the Cutibacterium acnes does not produce the same antimicrobial peptide in normal skin and acne skin. So acne a predominant phenotype, which is 1A1. Why is it important? Because here in this study, we use cutaneous explant of skin. This cutaneous explant of skin has been incubated either only with one Cutibacterium acnes phenotype. So to simulate the loss of diversity, either with 3 phenotypes to simulate the diversity. And as you can see here, when you have a loss of diversity, only one commensal bacteria, you induce an activation of innate immunity and the production of interleukin 8, interleukin 6, you don't induce this secretion when you have a diversity of Cutibacterium acnes phenotype. Just ici, we summarize. Dysbiosis induced by the modification in the ratio of phylotype with predominant phylotype. Then you are going to activate innate immunity. And so I am going to show you 3 examples illustrating the modulating role of the skincare. First, cleanser. Second thing, with isotretinoin. So many essential words, and sometimes they combine with message or dermatologist to increase the penetration. It was the case of this young woman, and you have to know that the compound of essential words show an affinity for the stratum corneum. It's okay. But if you increase the penetration, you will modify the microbiome, induce a dysbiosis, and you are going to activate the innate immunity. So just look at this patient. So finally, cycling and moisturizing cleanser for a short period topical corticosteroid, we were able to improve the skin, but unfortunately, just to show how a strong activation of innate immunity can induce a strong activation of this innate immunity. Cleanser, antihistaminic, topical corticosteroid, and then cycling. Other examples, the topical antibiotic. We use a lot topical. So yes, for general practice, in addition to dermatology. And what is the consequence? When you use a topical antibiotic, very quickly, you are going to decrease, destroy, to kill the sensitive bacteria. But at the same level, the resistant bacteria are going to increase, to proliferate, and then, so you will have a dysbiosis and in addition, a bacterial resistance. So it's why is it very important to avoid the use today of topical antibiotic, and it is even in all the international recommendations. Just at the cosmetic level, you have an ingredient, nicotinamide, which has been shown, so inducing a decrease of inflammatory lesions without inducing bacterial resistance. And concerning isotretinoin, it was one of my patients in consultation by here's general practitioner because of this papule and pester. And he asked he could increase isotretinoin, and definitively no. On the contrary, you have to decrease isotretinoin. Why? Because isotretinoin, so by decreasing, by inducing an aqueous ground, decrease, and in addition, induce some alteration of the stratum corneum. So it induces a dysbiosis. And as you can see here, this dysbiosis so induce Staphylococcus aureus, as I showed to you just in my first slide. And unfortunately, at the same time, you have a decrease of both sebum but Cutibacterium acnes. And it's another topic, but more and more we are discovering that Cutibacterium acnes, which is a commensal bacteria, play a role to protect the skin barrier. New topic, but very, very interesting topic. So it's very important when we prescribe isotretinoin cleanser, and if you decide to make a physical treatment. So finally, here you have the summary that you know very well of the pathophysiology of acne, activity, external factor, internal factor, and so the dermocosmetic permit to control skin barrier and microbiome at all the different steps of the acne. And that is so important in acne that we were several international experts from everywhere in the world, and we tried to develop recommendations for the use of dermocosmetics. Define the place of dermocosmetics in monotherapy, adjunctive therapy. Why? Here you have the answer with a survey. It's a world survey. We perform in many countries. And what we demonstrate is the adherence to the treatment is low, even with isotretinoin. You can see here poor adherence, 46%. So it means 1 among 2 patients has a bad adherence. And we define the profile of the bad adherence. It's generally patients, young patients. You also have often more men. But what you can see, we have a bad adherence with adverse event. On the contrary, and it is the alone factor, the prescription by the dermatologist of additional cosmetics improve the adherence. So, when at the moment we remarked that we have very few information in the international guideline concerning the management of dermocosmetic. It also was another reason why we decided to do this dermocosmetic recommendations. And here you have a very short summary. We use for that the Delphi method. And our conclusion was cleanser can remove surface sebum and debris while maintaining skin natural lipid barrier and hydration. Treatment target various aspects of acne, comedone inflammation, dyspigmentation, moisturize, repair the damage induced by topical, so restoring stratum corneum, hydration, reducing the transepidermal water loss, and irritation. Finally, photoprotection may reduce, so the pigmentation which can be induced by UV, and in addition, the erythema. So it's general recommendation for all acne patients, mild, moderate, or severe acne. So it's what we name the CMP, moisturizing cream, sunscreen, and in addition, and just concerning the photoprotection, it's particularly important because now we know that the pigmentation not only is induced by UVB, but also by UVA and blue light, and not all the sunscreen protects against UVA and blue light. So very important to discuss this point also with our patients. Just here, it's a table. It's not obviously a complete table, but it shows that when active ingredients in the field of cosmetics, they can have keratolytic, anti-inflammatory, control, microbiome, and skin barrier protection. And just here is the publication. I just would like to finish by explaining that finally the cosmetics have 4 activity. They have with it means that it increases efficacy of the drug. Second thing, it can improve the adherence to the treatment. So very important is the maintenance to prevent new lesions, to use products without any adverse event, and topical drug, corrective procedure, and CMP represents an holistic approach which can significantly improve our treatment, and in addition, the skin quality of our patient. And obviously, we don't have to forget the makeup. When we start a treatment is important. I have a makeup consultation in Nantes, and so you can see, so it can help the patient when they start the. So thank you very much.
Thank you, Prof. Brigitte Dréno, for your presentation. Professor will stay with us online in case any of you has any question, and she will join us during the Q&A session. Now it's time to welcome Dr. Anwar Al Hammadi and his lecture from Patient to Protocol, Personalizing Acne Therapy.
To have this connected with. Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to thank Alice and IDERMA for inviting me. The honor to be on this IDERMATOLOGY in the 7th edition. And I had the honor to attend, was presenting most of them. So I try to think what I'm going to present. First, I'd like to thank Professor Brigitte, and I'll start. She as a dermatologist. Now, I can tell you that I strongly believe in the power of makeup. Yes, the power of makeup, sometimes we utilize it, and we need to improve our skills as a dermatologist. Our patients sometimes doesn't mean that we are giving the treatment, but yet we can't cover till we see improvement. Especially we have lots of conditions can take a very long time till they see the improvement. So what I'm going to present to you over this 20 minutes, 30 minutes, I'm going to show you the personalized treatment. This is an approach. In fact, we use this approach in most of the skin. When it comes into acne, especially that we see it in both genders, we see it in adolescents, we see it in adults, we need to tailor this treatment. So I'm going to present to you the personalization of the acne therapy from patient to protocol. So as you know that acne, this is one of the commonest conditions we do see it in our daily practice. Psychological impact on patients. I will say that both gender, not only in female. So we need this kind of personalization and tailoring the treatment according to the presentation. Now, this is something I said worldwide. It's not only into our region. In fact, 650 million people are suffering from acne. It's not only limited to adolescents, can be seen at different ages. These are the data. But we do have a big percentage that is just the last decades, the number is increasing as from this reference. So this is what I'm going to present over this 20 minutes and how we approach the lots of new products in the market, some of them the last, of course, from the senior, sometimes we neglect or forget about the truncal acne. Some products specified for this area, and I'll tell you why. So let's start with this personalization of the treatment. It's personalization because the importance of personalization is very important. Right. In fact, in the last we're seeing publications. This is a publication from JAD from 2023 showing the importance of this personalization. Why? Because we have different presentation of acne. We have truncal acne, we have patients with the skin of color, we have patients presenting cystic type of acne, so different morphological presentation. So we need to personalize. Sometimes we see solitary lesion or one single lesion, yet it can end up with a scarring. So this is why we need to personalize the treatment according to the presentation. It's not like I call this as light acne or direct acne. I believe on what we see, the morphological presentation. So there is no one side that fits all the approach. severity and the triggers. We're living in skin color. In fact, lots of people, they get to treat, they are acne treated, but they are so bothered with the PI. And unfortunately, that can take prone for scarring and post-inflammatory. One of the important things, of course, in treat patients with acne, adherence. Excited, they start using their treatment, but they cannot really adhere to the treatment. So this is why we need to know and recognize those who are into the therapy, especially when that acne is a chronic condition. So what depends on age and the price, 7% for adult acne condition, female, efficient of the skin type, the psychological impact. Now, we do also information when it comes to pregnancy and lactation that we are limited with options, available options like azelaic acid. Sometimes it's not really enough, so we need to personalize. Even with pregnancy and lactation, sometimes oral antibiotics that are safe to be used. And as a patient, also skin of color, we can utilize and help them not only to treat acne, but also to prevent post-inflammatory hyperpigmentation. Now, do you believe that acne is skin disease? As we used to say that psoriasis is not a skin disease, psoriasis is a systemic disease. We know that most of our patients, when they come, they are really depressed. I'm sure that you've seen lots of patients, they are a little bit socially withdrawn. They are not much excited when they are invited. They don't want this family gathering if they have really bad acne. They try to come. In fact, I've seen recently one of the patients was saying, you know, doctor, I wish that we have COVID corona back. I said, why? I was hiding my acne all the time, but right now I can't really hide it anymore. So they were trying to hide their acne, so it does really affect the self-esteem. Some of them, they have anxiety, as I mentioned, low esteem, and a poor self-image. Definitely skin. Skin. I don't know if this is cutting off. Okay. Now let's move on about approach to the how we approach. I think this is sometimes really difficult. That acne straightforward, direct diagnosis. There is no sophistication that you can diagnose, but how you approach, where to start. I think most of us in a busy practice, sometimes we don't give. Please, the first visit patient, first consultation. It's not only medication, it's education. Educate the patients, especially if you're dealing with adolescent, also educate the parents and tell them about the importance of the adherence of the treatment. If you don't really educate them, and this is what's happening, they use the treatment, which is great treatment, but they don't see the improvement that they are expecting. So they go to another dermatologist and another dermatologist, and they keep shopping around. So this is why it's important at the first visit, you draw for them the approach, the line, and what's your treatment plan. This is first step. If this first step doesn't work, then we have a plan. Third step, and so on. Know that this is the gram-positive anorexia bacteria. In fact, it can cause bronchitis as well. That's been associated with the QT bacteria. And of course, the hyperkeratinization. 4 factors play the major role in acne. However, still we have, as you heard from the professor, that we have genetic and can play a role. So healthy diet can reflect healthy skin, especially with high glycemic diet, which can cause hyperinsulinemia and end up with more acne. So proper diet, healthy diet always reflect healthy skin. Now, the clinical spectrum, as I mentioned earlier, I don't like to divide acne or call acne, this is mild acne, this is moderate acne, because what you see moderate, maybe your colleague will see it as severe, or patient will see it as a mild. So ideally, acne should be based on what you see, the morphological feature. Is it comedonal acne? Because we know for comedonal acne. Is it cystic acne? We know this kind of therapy where topical therapy is not the way where we need to classify. It's okay. I can use the mic here if it's keep cutting off. Thank you. So this is what you see, as I said, the classification based on the morphology. You can see comedonal acne, cystic acne, pustules, where we know whenever we see pustules, of course, this is an inflammatory type of acne where the antibiotic can be a good choice to consider in those patients, especially if you have multiple. In fact, if you see one scarring, this is a sign for you to take it seriously. This is not enough to treat it only with a topical therapy. Here, where you need to use different modalities in order to prevent the scarring. All of us, we know treatment of acne is not difficult, but the treatment of post-acne is really stubborn and can be costly to the patients when they go for the machines and lasers or whatever if you've treated acne. Now, tailoring topical therapy, it's again something really important. And most of the time, as a dermatologist, we know we are dermatologists, we studied dermatology, we know that we have topical antibiotic, we have the combination therapy. Sometimes we neglect the power of dermocosmetics, not only because of the companies, but this can be a great adjunctive therapy and also as a maintenance therapy. And even if you are using whatever, you need something that can help, at least help the PIH or help PIE, especially when it comes into adolescent acne where their skin really cannot tolerate the hard products. Imagine if you have, and I'm sure all of you are seeing nowadays, 9-year-old coming with lots of comedones. If you get them different and acrylic, say, are you serious? Give this and adaptogene at this age, doesn't really make sense. So this is why we need more friendly that can be tolerated and doesn't cause pain. And most of the recent guidelines, in fact, they paid attention to the dermocosmetics, at least in the part of the treatment or as an adjunctive treatment. Now, again, know that topical retinoids still can play a major role in most of the types of the acne. I like to use it. Benzoyl peroxide is a great antibacterial. There is no resistance to it. However, I think all of you heard about the warning about the benzene product in some of the items that has benzoyl peroxide. So here where we need to be, and you know that our patients and their parents, sometimes they're exaggerating things that, oh, this product can cause cancer. Like you heard about it in the news, was everywhere. I remember it started last year with La Roche-Posay, L'Oreal, that the product has this, then the one that we have it in UAE doesn't contain. So we need to be prepared and ready to answer our patients, of course, in a scientific way. We're not here to defend the companies. Of course, the company, they should also be aware of safer products. Now, key message here for benzoyl peroxide, be careful. Patients, they don't leave their products
temperature. In fact, benzoyl peroxide, if left in a very warm climate, yes, it can turn into benzene, and benzene be linked with cancer. You have to be really careful about it. Yet, I'm still using benzoyl peroxide with certain percentage. If it's used carefully, it can be very useful. Topical antibiotics, I hate it. I don't like to use a single solitary therapy with topical antibiotics. We've seen lots of resistance where maybe it will be helping the first couple of weeks, then as don't see any change with it. So this is why we need to tailor the treatment. I like the dual or triple therapy now. Combination benzoyl peroxide with clindamycin, benzoyl peroxide with adapalene, with the tretinoin, which is good. So this is why some patients can benefit from this combination therapy. Now, oral antibiotics. All of you are aware, our talk is beyond this, but what I wanted to be really careful about when you choose oral antibiotic, we know that the gold standard is tetracycline. It's not macrolides. I still see patients are coming with clindamycin or erythromycin. This is why we're seeing lots of resistance in the community. Major problem. In fact, all of us, we are facing the resistance from antifungal. We know that with the long use of oral antibiotic, oral antibacterial, they have resistant and bacterial, right? Are you seeing this concern? Them itraconazole doesn't work. We give them terbinafine, it doesn't work. Why? Because of the abuse of the antibiotics. So here, if you use the antibiotic, be sure to give the right antibiotics, and for the period that requires, give it as a monotherapy. It should be combined with other therapy so that you and that may happen from oral antibiotics. Now, hormonal therapy, I do consider it sometimes, especially we have lots here of women that presenting with PCOS, they are presenting with irregular period, with hirsutism, with overweight. Those can benefit from hormonal therapy, whether aldactone, which has anti-androgenic effect and can help also the other problem, or birth controls, which we know that sometimes we face resistance from unmarried female that when you tell them, I'm going to give, this is part of the hormonal therapy, and some of patients can really benefit from it. However, if you choose this choice, of course, you have to monitor them closely, and you have to inform them about this. I think all of you are expert about. I love oral isotretinoin. If it's chosen properly, the right dosage, right monitoring is great. We're seeing also lots of patients after finishing the cumulative dose, they're coming back again, their acne is back. So isotretinoin is great, but choose the right patients and the right also monitoring for those patients, especially with the scarring acne. Now, resistance and relapse, we're facing this a lot. So we need sometimes this kind of adjunctive and maintenance therapy. You give the right treatment, you give whether the antibiotics or isotretinoin, but yet the patient still occasionally breaking out, especially in female around the period of time. They need something that can help them. One of the neglected parts of the body, that's the truncal acne. I have lots of female at the time before their wedding. In fact, they're delaying their weddings because they cannot really wear whatever they want to wear because their back is full of acne. They have to change the design, they have to change because of their back acne. So this is why also back acne shouldn't be really neglected. And always is important education to adhere on the therapy so that we will prevent the relapse on patients. Just quickly to in this case, just as a reminder for us, don't jump into the history is important, as in this young lady who's coming to the clinic. She's 30-year-old, 9 months history, stubborn kind of acne, and came, doctor, I want Roaccutane right away. This is what she has used topical clindamycin on that off. She used benzoyl peroxide. She did use also doxycycline for 2 months without improvement or a slight improvement. So she requested to use isotretinoin right away to give her. Just to give you also a brief, culture was taken, which is excellent for someone who has seen lots of pathology you need to do to know what kind of bacteria we're dealing. So the culture was negative. There's nothing here, culture. And hormonal workup, we see lots of patients, we mentioned especially on the lower side of the face or U-shape, rule out always hormonal acne or PCOS. It was all normal. So what are you going to do with this nice Filipino lady and telling you straightforward, just prescribe it to me? Will you extend for her doxycycline? Do you think we can give her another more than 2 months? Maybe it will be useful. Are you going to start her on spironolactone? Are you going to give her just isotretinoin? So what are you going to volunteer? Tell me what you want to do with this pleasant Filipino lady. Okay. The answer is none of the above. All what you need, just a proper history. In fact, the proper history here, okay. She was advised by her friend from the history to use what they call it, magic cream. Some populations here, they have their own recipes and their mixture of the creams for brightening and clearing. And she's been using for the pimples for many months. And in fact, it had clopidogrel cream on it. And we know that clopidogrel steroid-induced acne. All what you had to do with this patient, just stop the steroid that she's been using on her for many months. So sad and so sorry that to see our patients ordering by talabat their Dermovate cream and their Ilcom cream. And I did order for one of my relatives, just wanted to see if they're going to deliver it. In less than 10 minutes, it was with me at home, just without prescription, without anything. So are ordering more and more. So this is why I think that the health authorities, they're doing whatever they can do, but we need this kind of awareness among us, how we order medicine, even if we say that pharmacies, they want to get whatever they want to profit from it, but we need this kind order the medicine and we don't know what the diagnosis. Yesterday I've seen adult, well-educated patients, and they said, doctor, I had a rash. He's been using Dermovate cream on the face, presented with rosacea on the face. So this is why I think it's important also to ask your patients. You'll be really surprised what they are using. They think they are using something not related to their condition, but unfortunately. So this is what happened with that lady. Now, what's new in acne? Unfortunately, there is not much of new in terms of topical therapy, but we have a new, of course, from Dermocosmetics. So what I wanted to do here, clascoterone, this is the first topical therapy that has anti-androgen effect. Unfortunately, still we don't have it. According, it's an expensive therapy, but it's good to have something that effect. Now, terraferritin, which is Acleaf, I was super excited to have a medicine that fourth generation of retinoid to be available the COVID time, 5 years or even before COVID, 5 years ago. I was super excited. Topical retinoid, mainly for trichomoral acne. This is medication, not by Dermocosmetics. But the problem with it, anyone using Acleaf here? Okay, how's the feedback with you? Huh? Yeah, that is what they say for back acne. What I don't like about it, the super irritation they get from Acleaf. Most of them, they end up with burn. So what they've done, the company, nice, I like. They try to support the patient, and even for us as physicians. They said, you know what, tell them to apply it alternative nights, not every night. We told our patients to do it in the the irritation. Then they said, okay, start with it twice a week, only keep it for 15 minutes, then wash it off. Also, we did with that. Then they came up with the idea, the self-applicators, that they wanted to be sure that it. Still the irritation there. So from my practice, again, I'm sure maybe lots of colleagues, they are using it, maybe seeing no irritation, but my bad luck, I'm not seeing stop prescribing unless if the patient's coming to me, when I ask them in the history, what are you on? Some of them tell you, I'm using Acleaf and it's doing a great job. Carry on, of course. This is why it's important. Sometimes you don't really have to start whether face cleanser or using the right product and their skin is tolerating it, really to shift from one, they can stay on the treatment as far as doing the job. So in terms is one of, these therapies that we don't have minocycline. I don't like also minocycline. We stopped prescribing oral minocycline because of the lupus reaction as oral. We have doxycycline, we have limecycline, safer, and there is no lupus-like reaction. And also sometimes induced by minocycline. So no one is using it nowadays. Maybe are still some physicians in the States, but up to my knowledge, they minimize the use of minocycline. And top dapsone, which we don't have it here. Now, when we come into the main reason for treatment failure, what do you think? The main reason is compliance. Patient, they especially in of course in males, they want something quick, something easy to be, something doesn't cause irritation. So most of them, they stop the therapy because of the compliance. So this should not be really ignored. And we, as dermatologists, when we want new products, want something, as I mentioned earlier, friendly on skin, doesn't cause irritation, doesn't cause erythema, and also to help not only acne, and also the marks of even more bothering than acne itself. And this is a typical irritation that I do see, and most of the time I ahead of time in case if they notice this kind of irritation. This has happened from benzoyl peroxide. I love benzoyl peroxide. It's a great topical antibiotic. There is resistance when it happens. So sometimes it's good to do the test spot. Also, what I hate about benzoyl peroxide, the bleaching effect. Lots they messed up their clothes because the bleaching effect of benzoyl peroxide. So if you plan to use it, it would be always wise to start with a lower dose as 2.5, and based on the patient's tolerability, how to tolerate it, then you can increase the dose. So the limitation of our treatment options, sometimes the side effects that we're seeing, the long-term side effects, especially when mentioned with the antibiotics. And again, of course, we cannot use topical retinoids. Azelaic acid safe option to be used. Sometimes can be used without high percentage, also can be used. Topical antibiotic also during pregnancy and lactation. Has been changed. Remember, early we thought, okay, this is a simple way that to treat acne, but as I mentioned, the guideline is being changing. I may recognize what's the main problem. If patients are presenting with high sebum, high, very oily skins, lots of dilated skins, then of course you have to consider the systemic therapy. If patients presenting mainly with retinoids are still the gold standards, salicylic acid is a great option to be considered. If patient those with the skin of color, I like to give azelaic acid. Acid has antibacterial effect. The discoloration, PIE, post-inflammatory erythema. I found that PIE been ignored for many years. No one paying much of attention. I see PIE. I see darker skin. Second case, last case that I'm sharing with you. This is also a young lady. Eruption, as you can see, a little bit around the nose. She's 29-year-old. Years history of recurrent acne. And again, she used doxycycline, the ideal antibiotics, for 3 months, and shifted to limecycline, the cousin of doxycycline, for another 3 months. Still, she has this, what you see, option. And again, the swab culture was done. What do you expect here to see? This is the culture. So this is the gram-negative folliculitis, which I want you to be aware about it. Again, gram-negative folliculitis being ignored. This is because of the overuse of the antibiotics. Again, here the antibiotics will be useless. they're not going to improve. Here where you have to consider isotretinoin as far there is no plan for pregnancy. Now, what you need to know about the antibiotics health issue. And in fact, even in the news, they consider it as part of the terrorism using the antibiotics. Because seriously, we're suffering with our patients having this kind of resistance with different kinds of antibiotics and also resistant fungus because of the overuse of the antibiotics. So be careful when you prescribe it properly, the right group of the antibiotics to avoid this. So last but not superhero product of tonight, I thought that will have it on the table, but what I heard from Derma is going to come soon. I like the ingredient. I usually don't like to talk about the products. I like to talk about what I use, but as a physician, as a dermatologist, I always look at the ingredients. I wanted something, as I mentioned, lighten the skin, friendly the skin, because we learned from lot. It's a product, as maybe you heard from Dermocometics for sebum for the body, which unfortunately much in the market. There is one spray in the market, but I think we need more. Sometimes the different ingredients, vehicle that we see also play major role here. Especially, it's not only the acne itself, also treating the marks and also soothing the skin. It's very easy to be applied. It has also niacinamide, which has also another additive value for whether the marks or to decrease the sebum as well. Salicylic acid, again, for keratolytic effect and also for mild comedones. So this is the active ingredients about the product. And again, this is a very fresh publications about dermocosmetics. I think Professor Brigitte mentioned that we don't have much about the dermocosmetics application, but fortunately, there is more dermocosmetics publications coming with my colleagues from Saudi Arabia and different parts of Middle East. The importance and the power of the dermocosmetics in the treatment of acne. As I mentioned, sometimes we as dermatologists just treat, but with still patients, they need to be guided with a proper cleanser that keep and preserve the microbiome of the skin. Lots of patients, they can get better, but they can end up with eczema or end up with very irritated skin or broken skin. So choosing the right cleanser is really important, especially when they are in the treatment. Again, guide them about the right photo protection for them, light moisturizer that doesn't clog the pores. So this is all part of it. It's not only the mild acne. Also, even for severe acne, when you treat, they still need some products to work as adjunctive or at least as a maintenance therapy. And I think all of you, application from JAD 2024 from last year is an excellent review about the guideline and management, the management of acne vulgaris. Again, mentioning about the importance of dermocosmetics and those patients. Very nice tables, but as I mentioned, some of the products that we don't have it in our region, but I think it's good to have a look at it to understand it. So here, the key takeaways are from we need to treat the patients as a holistic. It's not only prescription and that's it, go home. Educate them, give them the plan. So also the psychological impact that they are going to get better with adherence of the therapy. So personalize for them the protocol in order to see the right outcome. And align the therapy again with the patient's goals. Some patients, they have different goals. They want something, for example, if you have someone who's getting married after a month, of course, certain products you cannot give them, and to keep that in your mind. So from patient to protocol, this is the procedure dermatology where you choose the right treatment. Future, I'm sure that we're going to see more and more in the future. We're going to see the AI-driven treatment algorithm, which is already lots of our patients taking selfie on their face, putting in ChatGPT, hi ChatGPT, what shall I use? And ChatGPT nicely give them the recommendation. Really, you cannot really imagine. Sometimes they're doing good job. I must admit, ChatGPT is learning from us and getting better and better. So maybe one day maybe we'll sit at home and have nothing to do, just listening. So AI driven, some of them are great tools, but I believe on the tailoring the treatment. Biomarkers, pharmacogenomics, of course, all these can be in the future considered for treatment of acne. The microbiome targeted therapy, again, Bioderma already is working on this. I've worked on this. Always important that to consider the microbiome of the skin whenever we use any treatment. With this, I'd like to thank you for your attention, and we're more happy to hear if you have any question or any comments from you. Thank you very much.
Thank you a lot, Dr. Anwar, Dr. Brigitte, for sharing your information and expertise with your colleague tonight. Session, we will have an online questions and offline question. We'll give the space first for the offline. So if you have any questions,
any question, any comment, feel free. If you have, don't be shy. We mentioned acne is something we do see it on daily basis. Some patients, we see them maybe 10 times per year. Same patients coming back. So this is why as dermatologists, we never lose patients, always have more and more patients, because same problem, they can come back again.
That's great.
So any questions, any comment, anything, feel free.
Yeah, I have two questions from
Yes, Sonia. It's the online part, yeah.
Yes. So the first question is from Twasul Al-Haj. She's asking, what on and off method do you recommend for clindamycin?
Sorry, can you repeat the question again? I didn't hear it well.
What on and off method do you recommend for clindamycin?
What on and off for clindamycin?
On and off clindamycin?
Method, on and off method.
Okay, as I mentioned earlier, clindamycin is topical antibiotic. Clindamycin ideally shouldn't be used as a solo therapy. Now, the good that's they added with the clindamycin maybe can minimize the resistance. The only time I consider using clindamycin as a solo therapy, but ideally shouldn't be used as solo therapy, because it will increase the chance of resistance. So if you have pustules, solitary, 1 or 2 occasions, yes, you can use it. But when you use the antibiotic, use it properly or don't use it. If you have occasional, I would go more with other antibacterial like benzoyl peroxide. The patient can tolerate it. I find it better. And
okay, Amin.
Thank you for the lecture, Dr. Anwar. I'm here.
Hello, sir, Doctor.
Opinion about blue light, and is it really equal to isotretinoin therapy?
About which one?
Blue light.
Blue light. Thank you, Dr. Khulud, for this nice question. There are lots of therapies and machines in the last 5 years. Laser therapy, I'm sure that you heard about laser therapy from different companies. And I was super excited. 2 years, they came to me in the clinic and said, you know what, Dr. Anwar, we've chosen your clinic. The clinics here in the Middle East to offer you this machine. It is equivalent to. Super excited and super happy to have a machine. I would say 70% of isotretinoin, because some patients, they can be on systemic therapy during pregnancy. We've tried it. My bad luck, expectation is really high, but we've tried it in lots of patients. The thing, the company, they are so confident that their machine still can help. So still they are offering to give more demos to try about therapy. Again, it can help to reduce certain. You can see the mask machines, blue light or red light. Some of them that has a little bit the heat can target the QT bacteria, but I don't really find it is sufficient to treat acne. Sometimes we need something really, but some patients can really benefit from it. So we are looking more and more. Some of them are targeted. I think that depends on what type of acne you're dealing with. If you're dealing with comedonal type of acne, I think it's still retinoids the gold standard. If you're treating inflammatory type of acne, yes, those may be, if you suppress the QT bacteria with the inflammation, that can be useful. And remember, sometimes we have different therapies. Yes, you can use resistant cases. You can consider. We've tried. Believe you can't. We have Erolase in our clinic. We do use it. It has relatively, I would say, good result, but it's not the one that I will rely that this is the treatment. But in certain patients, yes, we can. Any more questions? Yes. Yeah. Yeah, go ahead, please.
Okay. Question for Professor Dréno. Is there a role for low dose or intermittent isotretinoin in long-term?
Yeah, it's an excellent question. I think that when you have an important hypersevoria on the, sorry, you don't, you hear me? Do you hear me? No?
Yes, we hear you, Prof.
I don't think she can hear me from here.
You hear me? Yeah?
Yes, I can hear you.
Okay. It's that low doses of isotretinoin, yes. When you have an area in adult, and you can use low doses of isotretinoin, not taking in account the cumulative doses. It's of interest, but in addition, dermocosmetic is very important. Intermittent doses at the moment significantly less efficacy and more relapse. So yes, in mild acne, low doses. If you have severe acne, so you will need to have high doses. Remember that demonstrated that you have a correlation between the dose of isotretinoin and the apoptosis gland. And with low doses in severe acne, you have a high risk of relapse at low doses.
Thank you.
Good evening. My name is Dr. Ambreen. So first of all, very nice and insightful presentation. So my question is like, for most teenager patient, also I witness they come with the they are more disturbed because of the appearance, as you discussed. So how you deal with this type of the patient? Because I remember when I was in Canada, so the mental health is like more important. First it comes how you counsel patient here, then the medical treatment comes.
Again, Matri, and I think maybe I need to check my ears. Can you just repeat it, Doctor, again?
I'm asking about the psychological point of view. The acne have effect on the mostly on the people, teenagers especially. So how do you deal with the patients in that scenario? Besides medical treatment, how do you counsel them?
I mean, for adolescents?
Yes, mostly.
Now, I mean, adolescents, of course, they are coming with their parents. And of course, we shouldn't see patients underage by themselves.
Yes, of course.
Especially first visit. So it's not only for parents, and speak with the adolescent. Because sometimes we speak with the parents. No, still we need to speak. This is the patient. So tell them, educate them, because they are listening to what's in TikTok. They're listening to what's in Instagram. They're listening to the social media. Believe me, sometimes they listen to the influencer more than will listen to us. So remember, and keep in your mind, they've already probably tried some home remedies. So this is why educate them according to their level and tell them that you are here and they are here too, because they trusted you. They know that you are the best person. So show them what you are going to give them. Some of them, you don't blame them when they come and ask for isotretinoin or right. Don't blame them because this is what they heard that they say it. But tell them your case, current case, it doesn't require it. This is what it requires. Be patient. Take this treatment. We'll start with this treatment. Patient, if you show them the plan, sometimes ideally, believe me, it will make big difference with you. Write it. Put it. Plan A, we'll do this. Plan B, we'll do this. But the key, give it time because they will call you next week. Oh, I didn't get better.
Yeah.
It's too early. So adjust your treatment based on the response. Because as I mentioned, the key, first visit, education, not medication.
Yes, thank you so much.
Any more questions?
Question from online. First one is, what would you use after the pimple is gone and it still show dark spots?
Would you repeat the questions?
What would you do, or what would you use after the pimples but it still shows dark spots?
Yeah, I mean, for this is the question for me, yes, or for Professor? Professor Brigitte, do you want to come in and comment on this? We have a question here. What would you do for the PI of the acne? How you deal with it? You give them something topical, you reassure them, you do a chemical peel, you do laser. What do you do usually with your patients?
So I think that the best thing clearly is a prevention. Phototype 4 to 6. So that means as sunscreen, not only UVB, but mainly UVA against the blue light, because we know now that they pigmentation. When my patients have a pigmentation, I use azelaic acid, so mainly. I also use tartanic acid. We have some with combination of azelaic acid, niacinamide, but clearly pigmentation a big problem. Prevention, it's clearly the most important part. What do you think?
So what, again, I agree with the professor. You have to tell lots of our patients, they keep picking the pimples, and this is what they end up with PIH. In our region, again, some of them are also exposed to the sun without protection. So protection, sunscreen is really important. The good thing now we have some screen that can be tinted, they can cover when they have the pigmentation. I like azelaic acid for patients presenting with PIH, safe, also can prevent a little bit of acne. I rarely use hydroquinone on those patients. Unfortunately, also hydroquinone over used, self-used here, and sometimes even used as a combination with a topical steroid as a combination therapy, what's known as a Kligerman formula. So if it's simple, I like azelaic acid. If it's more than that, you can again consult based on what you see, whether if you wanted to do chemical peeling or any other therapy. Again, tailor treatment based on what you see. Any question?
The second question is it safe to use topical isotretinoin for the long term?
Topical which one?
Isotretinoin, sorry, French accent.
So, Professor Brett, you want to comment? Is it safe, topical retinoid for long term?
Topical isotretinoid or retinoids?
Topical retinoid.
Retinoid.
Yes.
So yes, you can use topical long period without any problem really. Just be sure of the good tolerance. If you have irritation, so you have to stop because you increase the risk of relapse. But you use it only in the evening, and if you have a complete remission, often I give every 2 days or every 3 days in the evening only. And yes, for me, it is one of the best treatment for the maintenance, and you can 1 year if you want, no problem. Just be very careful with the sun, specifically use obviously in the evening.
So the answer here, it is safe to use for long term. However, you wanted to avoid the irritation, especially in patients, for example, with a background of rosacea. I'm a big fan of topical retinoid because remember, it's not only for acne, for prevention of acne, maintenance, and also as anti-aging. So sometimes a very cheap product can also help the fine wrinkles, or at least bring the fine. The good thing, we have different preparation with a cream or something with a less concentration. But it is safe, but remember, also it's not advised to be used during pregnancy and lactation. The last, I think, question, it still have?
Yes, we still have one more question for Professor Dréno. Is there a role for low dose or intermittent isotretinoin in long-term management?
I think that, just I mentioned previously, intermittent isotretinoin, so generally the result is not good. I think is it better to use low doses of isotretinoin in this condition? So you can use it for a long period without any problem. You don't take in count in this condition the cumulative dose. So the most important is to check about the cheilitis. For me, is it a very good doses to use? And avoid any irritations. That means obviously use dermocosmetic, good cleansers, good moisturizing cream, and sunscreen. But it can help specifically adult severe hyperseborrhea.
So we have lots of patients and lots of questions about isotretinoin, which is no wonder. It's a medicine that has a great effect, but keep in mind, it's a teratogenic medicine and also a medicine that cannot suit everyone. So we have to be really careful when we prescribe it. We have to monitor. Yes, fortunately safe, but we've seen patients with high liver enzymes, we've seen patients with hyperlipidemia, we've seen patients with increased intracranial pressure, we've seen patients with eye problems, we've seen patients with psychological mood swings. So yes, sometimes with the low dose may be unlikely, but also keep this in mind. Maybe one patient will present with these kind of side effects. You don't want to ruin your repetition with that. So consult the patients and tell the patients about everything they need.
When you have an adult female, I think a good alternative, taking account all the adverse events, is spironolactone. Spironolactone is patient relapsing or not improved by isotretinoin or with adverse event, as you mentioned. So it can be a very good alternative. We have very excellent results.
What dosage do you use spironolactone?
I use those between 50 and 150 milligrams. Never more. Never.
Professor, I'm facing with those patients. I like it's a great, especially patients with thin hair, the irregularity of the period that they are experiencing. So this is something that most patients dislike about it.
I think it's not this kind of problem, so you can decrease this condition to 50 milligrams, by example, but really, obviously combining medical treatment, I think we have very good result and specific truncal acne. Published a recent trial about that, showing that we have around 2.5 more good results than with doxycycline.
Thank you.
Thank you all. We are reaching to close our session tonight. I would like to repeat my thanks to Dr. Anwar, Dr. Brigitte. Thank you for sharing your insights, and it was an added value for your colleagues. I would like to invite our Middle East Director, Madame Lily Had. Thanks, our speaker.
We'd like to thank Bioderma team. Event, we can see it in 1 hour, 2 hours, but they've been preparing for this for many months. We'd like to thank.
Thank you very much. Sorry because of my voice. I was sick, so I tried to recover for tonight especially. I'm very happy to announce that this session was our 7th session of IDERMATOLOGY, that it's a session that we have all doctors from Middle East attending to this meeting. I would like to that we had 1,600 doctors attending online, and we were honored to have you all here with us. This lovely and very scientific session. I would like to thank you, Professor Brigitte Dréno, for your attendance and also for your presentation. Very fruitful, and we learned a lot. And for sure, I would like to thank you, Dr. Al Hammadi, that almost I can say all our IDERMATOLOGY has been hosted by you. I can promise no AI and no ChatGPT will replace you.
Well, thank you. So I can
No, never, never. We will not allow you. Very much.
So we should give it to our professor. Okay. Thank you. Thank you.
And also as something that
Thank you. We can
remember.
Thank you. So nice.
Much. Thank you very much for
Okay. Okay.
joining us. I hope you enjoyed.
اوكي 27 ناخذ هاي. ايوه ايوه. Come. Yes, maybe if you want to come.
Yes.
Thank you. Thank you. شكرا يعطيكم العافية. شكرا.
Thank you.
I'd like to thank all of you for coming. It was useful. Thank you.
Thank you.
يعطيكم العافية.
الله يعافيك دكتور. تفضل دكتور. هيشتغل.
Thank you. Thank you. Thank you. Oh, thank you. Thank you, my pleasure. دكتور. أهلا. كيف الحال؟ الله يعافيك يا دكتور. الله يسلمك دكتور. الله يسلمك. الله يسلمك.